Yes, yeah.
It's been
I'm
fun.
excited to do that. I
That's a
actually
good
haven't
time.
started working on it with him.
No,
We just
don't
have-
say that.
At lab, I sat at a table with a few other guys, and then from there, became friends with a few people, and then from there, I started sitting by them in class, and then went from there, flourished into friendships, and yeah.
Joined by Sean Erdahl, one of my students times 2, right?
Yes.
Cancer bio and genetics. How's your semester going?
Pretty well. I'm taking 4 classes with my major this semester, so I think this is the first time I've done that before.
Oh, yeah.
So it's kind of a huge juggle, but luckily it's only 14 credits, so it's not
Okay.
the worst. It's not like I'm taking a class in the same rigor as one of your classes.
Oh, wait, we're already on this. That's fair. Hey, now that you know that you've survived both of them, you're good, though, and you're better prepared, okay? I promise. Yeah, maybe I am cruel sometimes. We'll see. We'll see.
I think your classes
we'll
are
talk about it.
justifiably difficult.
I think it was fun. I remember the first time in genetics, you were like, "Yo, yeah, I hate you, Keenan, but your exams make me think." He didn't say he hated me, but
I don't know if I used the word hate, but
no. I think the first exam you were like, "Oh,
I think that was the cancer bio first exam.
oh, maybe, yeah, I don't know." It's okay. You pulled yourself up. Remember what happened on the genetics final, though?
Yeah.
Yeah, I can't break FERPA and say what happened.
Yeah.
But let's just say it was positive.
Yeah.
Right? Yeah, it was a good feeling. I remember you were like, incredible. And it was, yeah, can't say it officially, but we can, like that.
Yeah.
But Sean, tell us more about what it's like being a pre-dental, how you like make it work and like thrive.
Well, I guess we can start, my studying habits. I think a lot of classes, if you want to do well in them, especially on exams, I feel like you got to put in like a minimum of 8 hours studying for each exam. And that's like the bare minimum. I would say probably on average, I study 10 to 12 hours for each exam. Now, that is always the optimal studying duration. So if I have multiple exams in a week, it's more of a juggle. But I'd say most nights, every week, even if I don't have exams, I'm spending a lot of time doing homework, studying more than the average student is, I'd say.
Yeah, and that's like we're considering average, like because the other niche the show kind of has is like STEM, pre-med, pre-dental types where it's like, oh yeah, like you got to put all those chips over here, basically.
Mm-hmm.
What would you say, like, given like, so that's like, and that's the good thing to hear from you is your main strategy is effort, drive, let's do this. Yeah, and like I say, we've talked before where like credit hours technically mean 1 hour of this in class means 2 to 3 outside. So you're actually meeting those expectations for each class. Given that, what would some of the sacrifices have been basically because of that? Like because of that commitment? Yeah, I mean,
I think a lot of the sacrifices is having less time to do things outside of school. I think that's one of the big things. A lot of times my roommates, this is kind of a segue, but one of the things I like to do outside of school is play disc golf. One of my roommates, especially my best friend from high school, he likes to do that in his spare time. There's lots of times he'll go out and play disc golf, and I wish I go out with him, but I'm busy cooped up in my room or the library studying or,
dang it.
Yeah.
It's okay though, but it's all preparation for the DAT, right? When are you taking that again?
I already took that.
Oh, that's right. You don't have to say it, but you can like wink back at me if it like went good or like
It went well.
Okay, good.
I did.
Okay.
I did well above average. I scored a 21, which is pretty good.
Oh, dang. Okay, nice. Yeah, I got to look up the old handy percentile thing because I don't know it by hand.
And I honestly don't know it off the top of my head, but I'm pretty sure. I want to say that's in the 75th percentile.
Nice.
I could be wrong. I don't know.
No, but still,
I'd say that's around that.
Yeah. And I think that's actually a note. I don't know if we even talked about percentiles on the show so far for any listeners, but how like always check the percentile versus the raw score because like that latest batch of DAT scores or MCAT scores could have been just mega hard that time.
Mm-hmm.
And so like if you felt like, oh no, my raw score is slower, but my percentile is higher, it means and it sort of makes everything relative. So nice. That's awesome. That's good. So yeah, when do you start like the application cycle then?
That will be in June, but
Okay.
I'll start prepping for it in May.
Nice.
And I still have to write my personal statement. And part of the reason why I haven't wrote that yet is because I still need to get more shadowing hours and more importantly, volunteering hours.
Right. And we've had other like pre-health of many kinds on the show already. And that's the main challenge I'd say is like between studying, we've had a couple of like NCAA athletes on the show. We've had a couple people that like work a decent chunk. And so it's always like, that's the main like final piece sometimes.
Yes.
You're joining me and Zach in our little research project a little bit, though.
Yes,
It's
yeah.
been fun.
I'm excited to do that. I
That's a
actually
good
haven't
time.
started working on it with him.
No,
We just
don't say that.
We've had conflicting schedules, but
That's fine.
hopefully this week we can get going on it.
Yeah, so Sean's helping me out with a little data analysis with some lymphoma patients. So excellent work. No, I just saw an article in Forbes about like, hey, STEM students have a really tough time retaining, and they like fall out of college really quickly. But the ones that find any mentorship of any kind, whether that's an older student, a professor, a TA, anything, they're the ones that stay. What was one of the first examples that, yeah, you were like, hey, like I could, like, there's community here, there's good stuff here, type of stuff?
Genetics, actually,
Dang
your
it.
class, yeah.
Self promo.
I mean, so when I entered your class, I knew no one.
Oh wait, because that was
my
you were
first semester here.
Oh,
yeah.
I forget that. I forgot that that wasn't the spring, so you were new at MSU that year.
Yes.
Oh, cool. Okay.
Yeah.
So you guys up at that's awesome. Yeah.
So I had lab. I think when did we have lab? The second week or third week?
Yep.
One of the weeks. I had lab. I sat at a table with a few other guys, and then from there became friends with a few people. And then from there, I started sitting by them in class, and then went from there, flourished into friendships, and yeah.
Nice. Hey, and that's always the advantage. Like all the bio majors will tell you, like, lab, dang it. Lab's one of the times you could be like, hey, like we're in this together. That the other programs don't have when you don't have that lab kind of space. So I think it's awesome. I don't know. You guys were a special group. That was fall 23.
Yeah.
So that was fun. That'll be hard to top, to be honest. We had a good crowd this one, but not quite there. But no, awesome. And then in terms of like I'm trying to think more on the pre-dental stuff. I want to highlight some of the strengths you gave. Like we did a practice interview once for dental school. And so this is sort of advice, and we can break this down more. This, for pre-dental students, listen up. You're going to get asked, what's your weakness and what your strength is. And again, use the strength question to highlight what you're good at. I've asked 100 times, what's your weakness to any pre-health type person? And I don't know, for practice stuff, right? Because I'm kind of like one of the de facto pre-med and like helper people. So a lot of the time we are filled with like, I'm a perfectionist. I care too hard, or like not the full Michael Scott, like
weaknesses that can be strengths.
Right. And it was like, saying. Yeah. And it's like, it's fine. Like you're allowed to spin it that way. That is totally fine. I get it. What did you say though?
I said my biggest weakness was probably my manual dexterity.
And I was like, I almost like stopped. And I think you were like, was that okay? And I was like, I've never heard somebody be that honest in a thing. And I was like, you were like, is that bad? I was like, no. But it wasn't that it's my weakness. You backed it up with like, I've identified this as something I want to get better with, and I'm gonna. And that I was just like floored. I was like, oh my God. It was like getting kind of nuked in the interview for me, because it kind of broke like a wall basically that you typically feel in those interviews. And I was like, dang, this is perfect. Like that's exactly what somebody wants. Somebody who's honest and is like, I need to get better. So anybody listening for that part, yeah, like don't be afraid to be yourself, especially in these interviews and these personal statements, especially in the age of AI. People have been reading these personal statements and they're clearly getting like, oh my God, this is clearly again written by just like the Real and Delve and the ChatGPTs and stuff. So don't be afraid in the personal statements to get a little more you and a little more like funny or raw, or like, I don't know, throw in an exclamation point or a joke in there. But as you're thinking of personal statement stuff, what directions kind of are you thinking? What are some of the challenges?
I think the biggest challenge is like I said before, this is my volunteering hours. I think I've had like about 10 hours. Mm-hmm. For dental school, they recommend about 100 hours. Now I'll say volunteering is not a requirement for dental school, but it is heavily recommended. So one of the challenges I have in college is finding time to volunteer. Now, luckily, the breaks we have are the perfect time to do that, and that's what I've kind of been doing. This break, I think I'm going to try to volunteer at the American Red Cross in Blaine. I know they have one around there, so that's kind of my goal. as well as shadowing dentists
Nice.
and specialists.
That'd be awesome. Yeah. When the time comes to apply, where are you going to try to apply to?
Well, I'm going to apply to the U of M,
Oh, yeah.
and my probably second option or second best choice, I'd say, is Creighton.
Okay. Yeah.
Yeah. But then I'm probably going to apply to like 20 schools.
Yeah. I do have an advisee and I love them. They only applied to 5 one of these cycles. And I was like, not enough, man. Like,
Yeah.
you got to do so much more. Like, and I'll keep my friend anonymous, my dental friend from Carleton. He had like a 98th percentile DAT.
Wow.
He went to Carleton. He had about a 3.8 or 3.9. He only applied to U of M and he just got straight rejected.
Really?
Because they always almost want that gap year too, to just see like, hey, you worked, you did your thing, you did this. And I do think he was also in football, so he like again didn't do as much volunteering and some of that, like some of the research stuff as much, right?
I'm surprised his DAT scores, GPA, and his extracurriculars with football didn't just get him in.
I know, we all were, trust me. But that's why, yeah, like 20 is probably the number. How many times did you practice the DAT before taking the real one?
I'll be honest. I think like 1 or 2 times.
Oh my God.
Yeah.
Well, 1 or 2 is better than 0.
Yeah. But I only studied for like a month for the DAT.
Dang.
I tried actually studying spring of 2024, and I intentionally took less credits than I usually do. I intentionally took 12 credits, and I tried to study, but I found it very hard to balance that with school. And I was like, okay, I'm just gonna hold this off till I get out of school that year. I think I probably did study for about like, I want to say like 30 to 40 hours that semester. So it's not like I just studied for a month going into the summer. I had some background, so I kind of knew what to do, but most of my studying was done in the month of June.
Perfect. Okay. Dang. So that's actually a cool roadmap then for like, okay, if you need to, this is what you can do. And here's the other thing. Oh man, I didn't know that actually. So this is a big testament to everybody listening that is in the midst of like, I'm doing all these biology and chem classes, right? If you just do it for the grade and you just are like, I don't care. No. You did it though to really learn it, and look what happened. And it actually paid off. So that's all I'm saying is like, if somebody's out there giving a million A's out, you got to maybe self-challenge yourself a bit. But you're smirking. What have I done?
Well, you're just talking about the grade thing, which is just kind of funny.
Why?
I don't know. I just kind of feel like I am one of those students who does kind of chase the grade, but I also feel like I also want to learn as well. So it's not like that's my entire drive.
No, definitely. I would say like if you want to characterize, yeah, you chase it, but for the right reasons. You wanted to know more. You put in the time for it. There are certains that just, that's all, they don't want to. They don't care what they learn. And I'm like, you're going to see this on the DAT or the MCAT later. They're like, I'll just study it then. And I'm like, no, now's the time. Help yourself.
If you go into studying any of those tests without any background knowledge, I promise you it's going to be at least 10 times as hard.
Oh boy. Yeah. I've seen, hey, we talked about percentiles. There's a lot of people, there's a lot of people that have those percentiles that are way down there, like dead on arrival down there. So don't ever enter that, because I'm pretty sure you have to show the DAT scores from all your tries, right?
Yes, but they care more about your highest. Yeah,
or the highest. Okay, perfect.
Yeah. That's good. You can retake the DAT if you don't do well. And that's okay if you don't do well the first time. I honestly did not expect to do as well as I did the first time.
Hey, you put in those the first thing you said, like, what's my study strategy? Well, about 9 to 10 hours per class per week. Yeah. And that's them.
Oh, sorry to interrupt you.
Oh, no, you're fine. Trust me. This is about you. The people don't want to listen to me. Trust me.
I was going to say for the DAT, I probably studied, I want to say 10 to 12 hours every day for like a month and a half.
Yeah. So, and it wasn't messing around studying either.
No.
Right.
No. So usually on the DAT, well, at least for the software I use, it's called DAT Bootcamp. Mm-hmm. That's what I used. And they have like a study schedule on there, but it's over the course of 3 months.
Yeah.
So I kind of had to like basically make my own based off of that. Yes. I sandwiched that schedule. So every day I had a schedule, and usually the day before I would make a schedule before that day, so I knew what I needed to accomplish that day. And most days I did not accomplish everything that was on my schedule, and that was okay. But that was just a reality of studying within that such a short time span.
Nice.
Yeah.
I mean, and then this is more, again, like an advice question for everybody listening. Like, when you study, what do you do? Like, maybe for class, but you could also break it into DAT if you want. Like, what is your, like, micro, like, what's your plan for, like, 20 minutes, then the next 20, then the next 20?
So I don't do that 20-20-20 thing.
No,
I know
okay.
that. Yeah, I know that is recommended. I just kind of do my own thing. I do it based on the class. So a lot of times I like to highlight my notes, and I know we're going to kind of get that to that
It's
later.
gonna be funny, yeah.
But also I during more classes that are structured with more, I guess, terminology. Like I feel like your classes you teach are terminology, but also understanding how different things kind of work together. So I feel like a lot of it is also kind of drawing stuff out too. But I feel like some of the classes I take are more just writing stuff down.
True, yeah, like kind of how with like cancer bio, it was a lot of like this hits this hits this,
Yes.
this does this. Genetics too is very like
Yes.
this is happening, logic, puzzle, maze, or DNA process. Yeah.
Yeah.
You've seen the patho and pharmadexes though, the big lists that I've made this year.
I've kind of seen it. Yeah, I've seen
Okay.
Zach working on it.
Yeah, Zach and Seth are always in on Fridays, but that's been my first change that I've done. We couldn't have done that in cancer though, because there doesn't exist like a full list of stuff. Like the pathodex has like 400 diseases, the pharmadex has 400 drugs. Like you're going to see it. But yeah, so you do pre-notes, go to class, ask questions. Then what's that final stage to like synth everything if you do or don't have practice questions?
That final stage is usually, for me, a lot of the times it is repeatedly reading over my notes or slides. And if I need to, make flow charts, study with friends. I think a lot of good studying comes from studying with your friends and forming study groups.
Yeah.
I think that's very important. If you have the opportunity to form study groups in college, I would go for it, because bouncing ideas off of people and bouncing off what you know kind of really helps you form those connections within your classes.
And it kind of goes up beyond what higher ed like shows on the paper, which is the grades in the class. It's like, hey, like I know these people, I know how to study, I know how to teach now, I know how to learn from listen to people too. I can't believe you pull off so much success by just rereading your notes. How dare you? I was hoping for like one of the big cognitive sci stuff, but the fact that you make flowcharts from the notes and you turn them into your format that you read the best. I think that's the key. I have too many students that rewrite the notes verbatim, and I'm like, ugh, maybe once. But the second time, I want you to draw with some arrows and some shapes and like put some connections together. Because like you said, I try to, with the note card that I give everybody for the exams, I try to make sure they're doing the application of stuff. But yeah, let's transition to one of the funnier parts. So in genetics, everything's going fine. Everything's good. You take your pre-notes. You're responsible. The reason I upload the slides is because I know the best students use them before class.
Oh, I did not do that.
Oh, you didn't? You just said you take the pre-notes.
I don't think I said that.
Oh. But I took the slides away from you guys.
Yes, because I use them to highlight during class.
Oh, during you. Okay.
Yes.
All right. So, yeah.
But it also helps me understand it, because before I was using the slides, I feel like I was writing down a lot of stuff and not listening to you as much.
Yeah, but like, come on. That's the cognitive stuff burning in. That's the stress. That's the Andrew Huberman telling you why it hurts to learn stuff is because the glutamate's happening.
Well, in my defense, I think I did better when I had the slides.
I know, yeah. Unfortunately, in the experiment of one person, yeah, you bucked my thing. Here was the situation. We were in genetics, and there were too many people just messing on their computers. To be fair, at least they were in the back, and they kind of knew their grade was cratering, but they were like, no. And I was like, okay, let's try this then. No slides, because you all are like messing around. And I remember you were like, but you'll give me the slides, right? And I was like, no, it's a blanket. You'll get the slides at the end of the week. And you're like, oh my God. It was so funny.
I mean, they really did help me out. And
I know.
It was, I could see why you took them away.
I was trying to, and like this goes back into sort of like teaching philosophies that are different. I was like, dang it, like I'm trying to, my goal in every class, whatever I do, is to get people across that finish line and pass. I was trying to do that, but I've since sort of changed that. I'm like, I've got to change more and shift more of this energy to this higher group here that need me, that I've like kind of ignored for like part of my time teaching sometimes. I even talked about that with a previous guest. And at the other end, like the slides are you guys use the slides responsibly and like to supplement and go really better. The same thing with recording classes each time. I always like people are like, how do you get attendance rates that are like decently high and you record it? And I was like, because if I take them away, I can see who views the recordings. It's all the students that are doing the best. The ones that aren't going to go, don't go anyway. I think it's just some psychology or circumstances, and like obviously wish everybody well, but you got to come to class, man. Come on.
Yeah. Can I say a couple more things?
Yeah.
I really started, I honestly don't think I used your recordings in genetics, but in cancer biology, when I was studying, I definitely rewatched the lectures.
Yeah.
I think that kind of helped me hone in on things I missed from the original lecture when I was there.
And that can be a difference with a 400 level class that's denser, right?
Yeah.
Yeah. With 200 level class, the challenges were like running. But no, I'm glad. See, and that's the point of leaving them up. That I'm always like to myself, I'm like, because it is a pain to upload them sometimes. It's like annoying, but I'll live, by the way. But I have had students be like, when is it uploaded? Like 5 minutes after class. And I was like, chill. Like, it's going to be fine.
Another thing I'd like to say is I do think the slides really do help me study, but also I kind of do like how you took them away, because you're not always going to be given slides in classes.
Yeah.
Slides are kind of like, I should say, like more of like a privilege.
I call them like the fun luxury.
Yeah.
Whenever I'm in one of my grumpy moods, I'm like, you guys, all you paid for was for me to talk for 3 hours and a test. And that's it. Which is a little cruel. But no, I mean, yeah, on your point, yeah, I mean, it's not always going to be the same style and the way to learn is one of the things you master kind of in higher ed.
Yeah.
While during this journey, it's going to be different. You are adjusting and like strategizing essentially. Yeah, I'm glad it worked out.
Yeah. And then I also want to say is just every professor has their own teaching style. And as a student, you kind of have to learn to adapt to different teaching styles. So some professors, they'll give you slides. Other professors, they'll teach right off a chalkboard. You just kind of have to learn your way and how you succeed, and you just have to adapt. That's just how college is. A lot of it is kind of finding yourself in the regard of how you are as a person in school. High school is kind of easy. I could probably study like a couple hours the night before an exam and do really well on it. Or in college, it's far from that.
It's different, yeah. Yeah. Someday we'll have a guest and we'll talk about high schools right now. But yeah, as far as I can tell, it's not a.
I cannot speak on high schools right now.
Yeah, I'm not gonna defend.
I haven't been in high school for 4 years, so I don't know if it's changed much since I was there. I assume not.
Yeah, I don't know.
Maybe with AI, because that wasn't a thing when I was in high school. Really.
We are, yeah. Because I was gonna ask you, what do you think the biggest changes have been for you as a student, and like where do you think things are headed with that, with education in general, maybe?
Thing is, I don't really use AI super often, except to like help me learn.
Mm-hmm.
I never have used it to write a paper or anything. I consider myself a decent writer anyway, so I never depend on that. But I guess as for where I think it's going, obviously, I mean, AI videos, they're so realistic, and I think they're almost going to be 1-to-1.
Yeah, you're the first one to bring up the videos,
Yeah.
and it's going to get.
They're kind of scary how realistic they look. And I think in the next 5 years, it'll be like almost impossible to decipher and make a distinction between AI and real life.
Yeah, I don't know. It'll be like the videos will have to have like sort of random things that like we find out is very hard for the AI to make effectively in a video. Like, I don't know, it's like, this video is real because you can see that like salamander clawing up the tree or something. And it's like, like some sort of marker that is like AI immune or something. But yeah, because the videos have always been, that's what's real. That's like the last thing that's real, even though you could do deep fakes and stuff 5 years ago.
Mm-hmm.
No, but no joke. I mean, if you turn on ChatGPT's voice thing and then you would put a video, hey, you got like a little, like a teacher or a tutor or something, like, and it could be used well. But I don't know. There's certain things that would be missing theoretically that we've kind of covered on the show a bit. Like, yeah, Ashton mentioned these like no discussion, no experiences that the AI has for like, this worked for me, or like I would do this next or something.
Yeah, that is true.
So we'll see what happens. It's going to be interesting, but
yeah,
I don't know.
This new company, they
who is it?
I don't even remember the name of the company, but they just unveiled a robot like for your house.
Oh,
yeah.
Scary.
And it can do like what they show in the video is like day-to-day chores. It can hang up pictures. It can, sweep. It can do all these, help you with your groceries, bring your groceries inside. Dang. It was pretty cool. I think I want to say from Norwegian, but I mean that kind of just made me realize how far we have advanced in that technology, and it's kind of scary.
Yeah, to say the least. Yeah, like 5 years ago, this was sort of talked about as like, oh, this might happen, but and then it's like, oh, dang, it's here. It's like happening.
But then the thing I fear most is just AI in jobs. I mean, who says AI robot can't, do a dentist job in like 20 years?
I think you guys are more safe because you actually got to dig in there and stuff. Like,
I guess more worried about majors like computer science and all that.
It'll have to adapt the same way that you said about adapting to different teaching styles, which will be like where's the niche that doesn't fill, essentially. Yeah. But that's gonna be different. I don't know. Each year will bring challenges because I still see the news and I'm like, this is different than what I remember from like a month ago.
Yeah.
So we'll see what happens. It's set to change a lot, but hopefully we can use it for the right stuff.
I agree. Yeah.
I hope so. Anyway, on that fun note, on that non-grim note, last question I was going to ask. So this all puts together. If you were the professor, how would you lead the class? Would you post the slides, post the record? Would you lead on chalk? Would you do slides? What do you think?
I think I would kind of do everything.
Okay. Yeah.
I would try to, at least. I know that's easier said than done, though, because, I mean, slides are very helpful for, I guess, presenting the information in a simple way for students. But I also feel like, at least for some classes, drawing is helpful. I mean, I'm in developmental biology with Dr. Charlin right now, and he does a lot of drawing. And for his class, I think that makes a lot of sense. He also uses slides, too, so he kind of uses them in
both
tangent with each other. Yeah.
Oh, that's good. Yeah. Our rooms never have a good chalkboard. I only have that little edge on TS 5352, but yeah, we give it a shot.
Yeah.
I'm not talented enough to do the chalkboard as much.
Hey, that's okay. I mean,
wait. Yeah. And
your teaching style works.
That's true. I don't think people have seen when I draw the mouse, remember?
The mouse?
Yeah. Remember how I draw mice?
Genetics?
Yeah. Remember how I draw these like hideous little monsters? Yeah. Remember this? We drew.
I don't know if I remember. Okay. Yeah. Okay. Yeah.
So for the viewers, there's my mouse. That's how I draw mice on the chalkboard.
See, as long as you say what it is before, I think it kind of works.
Yeah. It's not too bad.
And, that's kind of funny because there are a lot of your exams you do ask us to draw.
Oh, I know. Yeah. Yeah. But on the drawing, okay. Dang it. Yeah. On the exams, it's better to draw.
It is, yeah.
Because literally, like, if I'm in immunology, I'm like, all right, B cell kills, this thing via antibody or something. And it's like down there or something. Like, that can answer instead of a wall of text.
Yeah.
But then I've had people, and I think I brought it up on the show. I was like, I've had people that said, I don't draw. And they just took the L. They just took the 0 out of 4 points.
I mean, if they wrote, would they get partial credit? I feel like they should.
They can get full credit if they wrote.
Oh, really?
They legit.
Even if it says just draw and.
Yes, I'm not that big of a devil that I'm like, draw this pathway. So like in cancer bio, we had stuff that was like, draw this pathway versus this one or something, right?
Yeah.
Some of your classmates did just explain it. And I was like, oh my God.
Well, what I don't understand about that is I feel like pathways are just so much easier to draw because it's literally text and arrows.
Right. I know.
So is that just not like easier? What drawing is involved in drawing a pathway out? Arrows?
Literally arrows and squares and circles and a label, maybe.
You don't even need squares or circles,
no,
really.
You just do circles and arrows and say like this hits this like Mick. Mick goes here, turns this on, done.
Yeah.
The cell grows. Yeah. That has been a strange thing where it's like, I don't draw. And I'm like, you could have even just explained. I wouldn't have taken points away.
Yeah, I mean, explaining it, I think, would take more effort, personally.
I do the drawing stuff to again, honestly, make it easier on you guys, make it easier on me. But at the other end, guess what? You guys are going to work with patients, right? Do patients want to read your text? No, they like little drawings. People love pictures the best. Then they love numbers. Then they like text. Like I've said it a million times. So yeah, getting decently okay at drawing like, complicated stuff, but getting it across, I don't think it hurts.
I like drawing on exams. I like doing both, so I always like when there's a variety of questions.
Yeah,
involving
and I usually give the choice. Yeah, but nice. Well, anyway, Sean, thanks so much. Do you have any other further advice for the audience?
I mean, I guess for pre-dental students, just stick with it. It's tough. It's not easy, but it will pay off. And For your DAT, that is the most important test you will take. So put everything you have into it.
Yeah.
That's all I got to say.
By preparing in the classes first.
Yes. Yes.
All right. Awesome. Thanks so much. This was a great episode, insightful, and you made fun of me plenty, so I'm happy for that.
Thank you for giving me the opportunity.
Thanks.